Hello everybody, this is Dr. Jean-Guy again. I'm just want to give you the tip of the week. Oftentimes people ask me about what is different about what you guys do at your office. And I just want to explain to you today a little bit about what makes our office different. And when I tell a patient that, what we do in this office, even if a person has seen other chiropractors before, that what we do is very different than what most chiropractors do, is because we specialize into this particular technique. It's called chiropractic biophysics, and also in short, we call that CBP. And chiropractic biophysics specialize into doing spinal correction. And what that means is in our office, most chiropractors would do chiropractic adjustment, which means that they would have chiropractic adjusting tables. And you would go to their office, you would get a chiropractic adjustment. After that, you would go home. That would be the end of it. You might be getting some exercise to do at home or things like that. So at our office, what we do is we do this thing that is very specialized. It's called spinal correction, right? And again, the term for it, it's called chiropractic biophysics. It started back in 1980s or so. And what we do is we specialize into changing the spine physically. But in order to do that, if you look at a model of the spine, right? If you look at this model here, if I were to cut a person wide open, right, the first layer we would get to is the muscles, and the second layer you get to is the ligaments, and then the third layer would be the spine itself. So when we do a chiropractic adjustment, you realign the spine, but what's holding the spine together is the soft tissue around it, which is the ligaments and the muscles, right? So what we do is after a person get a chiropractic adjustment, which is very specific based on their posture. So for instance, if I look at the person from the side and their head's forward like this, right, we would bring their head back like so. And we would adjust the person like that. So many of you are already patients, so you know that you've experienced that. And then after that, we would go into our rehab area, and then we would do the same thing for as exercise goes. So we would work on muscle for the exercise, right? And then we do traction for the ligaments. So for instance, if a person has what we call forward head posture, if their head's like this, we would do exercise to bring their head back like so. And then also if a person has forward head posture, then we would also do traction to bring their head back on top of their shoulders. The purpose of traction is to stretch the ligaments. Usually that doesn't require any movement. We're just stretching the ligaments, right? And how you do that is like taking a rubber band, if you can think of it that way. Taking a rubber band, you stretch it, and if you let it, if you let it go, it's going to go back to its original position. But if you stretch it long enough, you're going to create what we call permanent deformation, right? So in chiropractic biophysics, when we start applying, once a person starts feeling better, then we apply those methods in order to change the spine and to start correcting the spine to make you more mechanically sound in a gravity environment. So I just wanted to share a little bit of that with you today, because a lot of people are wondering what do you do in your office that is different. And over the next several weeks, I want to talk to you about the different things that we do in the office and why this office is different, and why we are excited to share with everybody what we do and why we do it and how it can benefit you. Have a great week.